Greetings and welcome to Wally's nursing videos. Today we will discuss intrapartum care to include the stages of care, the nurse's role in providing comfort as well as potential complications during this period of the delivery process, physiology of labor. The intrapartum period, encompassing the 3 stages of labor, marks the onset and progression of contractions leading to the birth of the baby. The first stage begins with the onset of regular contractions and is divided into 3 phases. Early labor. Contractions gradually increase in frequency and intensity, causing cervical dilation and effacement. Active labor. Contractions become more intense and frequent, leading to rapid cervical dilation. This stage typically ends when the cervix is fully dilated, 10 centimeters. Transition. The transition phase is characterized by intense contractions and emotional upheaval as the cervix completes dilation, preparing for the onset of the second stage. The second stage, also known as the pushing stage, begins when the cervix is fully dilated and ends with the birth of the baby. Contractions help the mother push the baby through the birth canal, aided by the natural bearing down reflex and maternal effort. The third stage involves the delivery of the placenta, which separates from the uterine wall and is expelled from the mother's body. This stage typically occurs within 30 minutes to an hour after the birth of the baby. Promoting comfort during labor. Nurses play a crucial role in promoting comfort during labor by providing a range of supportive measures. Positioning. Encouraging changes in position to facilitate labor progress and relieve discomfort, such as walking, squatting, or using a birthing ball. Massage. Applying gentle massage techniques to ease muscle tension and promote relaxation. Relaxation techniques. Teaching breathing exercises, visualization, and relaxation techniques to help manage pain and reduce anxiety. Pain management options. Offering pharmacological options, such as epidural anesthesia or analgesics, as well as non-pharmacological methods like hydrotherapy, acupuncture, or TENS, transcutaneous electrical nerve stimulation for pain relief. Nursing care during labor. Intrapartum nursing care involves comprehensive support and monitoring to ensure the well-being of both the mother and the baby. Continuous monitoring. Monitoring maternal vital signs, fetal heart rate, and uterine contractions to assess progress and detect any signs of distress. Assessing progress. Performing vaginal examinations to assess cervical dilation and fetal descent, providing feedback to the healthcare team, and facilitating informed decision-making. Emotional support. Providing reassurance, encouragement, and empathetic listening to address the mother's emotional needs and alleviate anxiety or fear. Advocacy. Advocating for the mother's preferences and choices regarding pain management, birthing positions, and interventions, while also ensuring adherence to evidence-based practices and safety protocols. Let's explore each of these intrapartum complications in more detail. Prolonged labor, dystocia. Prolonged labor, also known as dystocia, occurs when labor progresses slowly or stalls, resulting in extended labor duration beyond normal expectations. Causes of prolonged labor may include inadequate uterine contractions, hypotonic contractions, cephalopelvic disproportion, when the baby's head is too large to pass through the mother's pelvis, malposition of the baby, or maternal exhaustion. Signs of prolonged labor include slow cervical dilation and effacement, failure to progress despite regular contractions, and maternal fatigue or distress. Nursing interventions may include encouraging position changes, promoting hydration and nutrition, providing emotional support, and assisting with pain management techniques. Collaboration with the healthcare team may involve the consideration of augmentation methods, such as oxytocin administration or, in severe cases, cesarean delivery. Fetal distress. Fetal distress occurs when the fetus experiences compromised oxygenation or other signs of distress during labor. This can result from various factors, including placental insufficiency, umbilical cord compression, or maternal hypertension. Signs of fetal distress may include abnormal fetal heart rate patterns, such as persistent bradycardia or tachycardia, meconium-stained amniotic fluid, decreased fetal movement, or late decelerations. Nursing interventions focus on immediate assessment and management to alleviate potential causes of fetal distress. This may include changing the mother's position, providing supplemental oxygen, administering intravenous fluids, or preparing for expedited delivery, depending on the severity of the situation. Umbilical cord prolapse. Umbilical cord prolapse occurs when the umbilical cord slips down into the birth canal ahead of the presenting part of the baby, such as the head. This can lead to compression of the cord, compromising blood flow to the baby. Risk factors for cord prolapse include premature rupture of membranes, breech presentation, multiple gestation or excessive amniotic fluid, polyhydramnios. Signs of cord prolapse may include sudden fetal heart rate decelerations, visible or palpable cord protrusion from the vagina, or a sensation of cord pulsation during vaginal examination. Immediate nursing actions involve relieving pressure on the cord by elevating the presenting part of the baby, placing the mother in a knee chest or Trendelenburg position, and administering oxygen to the mother. Prompt delivery, either by emergency cesarean section or expedited vaginal delivery, is necessary to prevent fetal compromise. Shoulder dystocia. Shoulder dystocia occurs when the baby's shoulders become impacted behind the mother's pubic bone after the delivery of the head, delaying the birth of the body. Risk factors for shoulder dystocia include macrosomia, large fetal size, maternal diabetes, prolonged second stage of labor, or previous history of shoulder dystocia. Signs of shoulder dystocia include difficulty delivering the baby's shoulders, the turtle sign, retraction of the baby's head against the perineum after delivery, or difficulty delivering the anterior shoulder. Nursing interventions aim to assist the provider in resolving the shoulder dystocia promptly. Maneuvers such as Mac-Roberts maneuver, hyperflexion of the mother's thighs onto the abdomen, or suprapubic pressure may be used to dislodge the impacted shoulder and facilitate delivery. Additionally, nurses must be prepared to call for assistance, including obstetricians, pediatricians, or anesthesiologists, to ensure the safe delivery of the baby. In all cases of intrapartum complications, nurses play a critical role in recognizing signs of distress, providing timely interventions, and collaborating with the healthcare team to ensure the safety and well-being of both the mother and the baby. Effective communication, quick assessment, and decisive action are essential for managing intrapartum complications and achieving optimal outcomes.